So we provide the courses for all healthcare professionals. We are helping to migrate to Australia. Personally, it took me around 8 to 10 years to be here in Australia. But this is very simple and very nothing extraordinary you need to do. You just need to pass the exam and you can come to Australia within 6 to 1 year, 6 months to 1 year. It is maximum time. Okay. So even I don't know earlier, so I'm just trying to create the awareness among the healthcare professionals, especially in the Indian and subcontinent population, so they can migrate to Australia. So at Academically, we provide the assistance for A to Z, including the documentation verification for exam pass, English pass, and visa and job assistance as well. So this is my about me. So I did my PhD from University of Sydney in clinical pharmacology. So I'm basically a Indian pharmacist. I completed my bachelor's and doctorate degree from India and PhD from University of Sydney. Last 10 years I'm teaching in Malaysia, in Australia. So I work in India around 3 to 4 months only, around 4 months as the assistant professor from the university, and then moved to Malaysia where I work around 4 years, and 6 years now I'm living and working in Australia. So around 10 years of teaching experience in clinical pharmacology and public health related subject for healthcare students. These are some of the faculties for AMC course. Uh, Yes, so mainly like what are the opportunities for you in Australia? So Australia provide 190,000 permanent visa, PR visa. So you can live and work permanently in Australia with your family. So you can migrate Australia with your dependent. Okay, and otherwise there is so many job vacancies currently available, and doctor is one of the in the critical shortage list. They need a lot of doctors in Australia. So on an average salary for a general physician up to 400,000 is on an average salary around 2 CR per year you can make. Okay, so this is and Australian Medical Association. There is one article recently published. They are saying that uh, project that there's a lot of shortage for the GPs and they are struggling. That is going to be more worse in near future. So, what is the salary for a medical doctor in Australia? I'm just talking just a normal. I'm just GP. I'm not talking about the specialist here. So in Australia, you can see a maximum of 60 patients per day. This is the maximum patient you can see per day in Australia. And the payment, the government will pay you around 21 to $50 per patient. This is based on the categorized based on the procedure you are performing. Okay, so minimum 21 and maximum 250 per patient you have to charge. So on an average, basically you have to work for 5 days, 38 to 40 hours per week, 8 hours per day. I can say for 5 days if you are working. So if I see, I have met basically so many of my doctors. They are personally my friends, even my GP here. So they are saying that 40 patients on an average they see per day. So if you are seeing like 40 patient per day, and let's suppose $30 you are charging on an average for per patient per dollar, $30 per patient. So it's going to be a 1200 AUD per day. Okay, so approximately if you calculate it, like around 12 to 13 lakh per month easily you can make in Australia as a GP. This is the calculation in Australia, the salary wise. But in general, if you are working like when you pass AMC Part 1 and you have to work as a junior medical officer or resident medical officer, so your salary is going to be 80 to 120,000 per year. Okay, and this is basically Monday to Friday if you are working 8 hours per day, and if you are working in Saturday, also Saturday or after hours means after 6 o'clock. Okay, if you are working after that, your salary is going to be a 1.5x. Or if you're working in Sundays or any public holiday, then your salary is going to be a 2x. This is the government regulation in Australia. It is not just for the doctor, for any jobs if you are doing. So you will get the paid as per this rule. Okay. So on an average, as a if you just pass AMC Part 1 from from your home country, like India, and then you can start looking job. At least you will get this much salary. That might be this is one question in your mind, sir. This much money is enough for me and my family to migrate. For example, like husband, wife, and you have two kids. You are looking to migrate to Australia, and how much money you need basically, to survive in Australia. So I can give you here my personal experience, my personal. So when I came to Australia, so I came on a scholarship to do my PhD. So I was getting salary 28,000 per year. Okay, so in that I easily managed to live with my wife in Sydney. Sydney, one of the um, costiest city. The rental is very high in Sydney. Still, we nicely, luxuriously, not very luxuriously, I can say, but ordinary, like, life we live in that amount. So even nowadays, if you are with two kids, husband, wife, easily you can manage up to 35 to $40,000 per year easily, and you can save rest of the money. Okay, so easily this is the more than enough for you to live and work in Australia, because if you have a two kids, the education for kids are free in Australia. You no need to pay any fees for them, or healthcare also is free in Australia. So if anything happened to you or your family, so these are the free for you, so no need to worry about this. So if you see here, this is the number one website, at talent.com.au. So they are mentioning that resident medical doctor, they earn around 108 dollar uh, per year salaries, and hourly 55 dollar per hour basic salary. Maximum is going to be around 2 lakh, and minimum this is like 98. Okay, this is a minimum 98 and maximum 98, and on an average 110 around, more of the doctor they will get when you are working as a resident medical officer. So there are some other benefits, as I mentioned, that education is free in Australia, healthcare access is free in Australia, professional development. For example, now you want to attend a webinar or any online short course you want to do, or any conference you want to attend. So in that case, the hospital highly encourage, and yearly at least 1 to 2 times they will pay your all the bills you have to go. So professional development, you can do whatever you want to. You want to update yourself in your own field. Work-life balance, I mentioned that you have to work for 40 hours weekly, 5 days, 8 hours per day. That's the times you can give to your families. Easily you can manage your here. And this case is very worse in India. Indian doctors, I know, in my personal family, there are several doctors basically. So sometimes, my cousin basically, she's saying that sometimes they stay in hospital up to 48 hours, 72 hours. Sometimes they even don't have time to go back to, uh, to go back to the home. But here, you just need to work for 8 hours, and you have a lot of time for yourself. And quality of life, obviously, very high compared to India, high potential earning. And these are some of the factors you think to migrate to Australia. So there is some steps you need to complete in order to migrate to Australia. So first step, document-based verification. We will help you to complete, so no need to worry about this. And then number two, this AMC exam. We will provide you the coaching up to 4 months. Live classes we take. We also record the session. We understand that you are doctors. You might have the not have the time to attend all the classes. So we take some classes on weekend also. Okay. And our faculty basically Indian faculties, they pass this exam, they gone through the same journey. Now they are practicing, yeah, in Sydney, Australia. So they will just not just help you to pass the exam, they will also help you in the other ways, like like jobs, your CV, cover letter, what kind of question they may ask you in interview preparation, and so on. Okay, all those things. So after this, you pass this exam, and you can give this exam in your home country. And there are 10 times they conduct this exam, like monthly exams. So whenever you are confident, you just need to book the exam and you can write. If you are looking this exam, for example, UK PLAB. So PLAB, at least you have to wait for up to 18 months to get the seat, or maybe someone has to cancel that seat, then you have to get the seat. So very difficult for plan, and nowadays I'm getting a job also very difficult in UK, and same for the US. So in that case, Australia is, whenever you are confident, you can just book the exam and you can write. There are 15 exam centers currently in India, so easily you can write this exam. And once you pass this AMC part 1, then you also need to pass one English test, whether it is PT, OET, or IELTS. So these are the three tests, and you have to go for academic one. So there is a two type of this English test, like general or academic. So you have to go for academic because you are trying to register yourself as a healthcare practitioner in Australia. So you have to choose IELTS academic or PT academic, not the general one. And the score, you need to go for IELTS 7 individual band, or 65 in PT or OET. So IELTS little bit hard, or the tough exam as compared to PT or OET. So I personally highly recommended go for PT or OET. So if your score 6 in IELTS, if you are scoring, so easily you can score 7, or easily 7 in PT or OET. Okay. So these are the easy exam, and OET is meant for only healthcare professionals. This is also one of the easier exam for you. Then we can go for, so these three steps you can complete in your home country, and you are eligible to start looking a job. You can find a job as a GMO or RMO. The hospital will sponsor you the work visa. Then you can come to Australia, start working, and simultaneously you can basically prepare yourself for AMC Part 2, or very good chance for you to get WBA, work-based assessment program also you are. Centers in India, and you can read a lot of blogs in our website. Also, we always write and update it in our website regarding the AMC journey. So the other English requirement, as I mentioned, that 7 individual band in IELTS or equivalent PT 65 or B in the OET. And skill assessment or document verification will help you to complete with your degree, transcript, if you have any work experience, or well, passport, government ID proof, or passport size photograph. Medical registration is mandatory if in case if you graduate from India. So there will be 150 MCQs in 3 hour time. So on in general, 50% basically you need to score. So they give basically like 500 mark. There is a scale basically 0 to 500, and if you score to 50, you will pass this exam, and no negative marking in this exam for this. I'm sorry. So we provide coaching you around 15 to 16 weeks, up to the 4 months, including the revision. A lot of the mock test and current tests we have, including this. So we will cover A to Z. So you no need to buy any other book. We will give you the all the materials, each and everything you need to pass this exam. As I mentioned that our faculty is qualified AMC, they pass. They are graduate from India and from Sri Lanka. So once you pass these exams, and then you are eligible to apply PR visa, permanent visa like 190, 186, 189, and sponsored visa, you are eligible like 4491, and these are also some of the visas you are eligible to work. These are some of the media coverage. This is recent published from Times of India about academically. This is from News Nation. This is also one of the Indian News Nation. This is Australian media. They covered about the academically. So the fees, our team will give to you the more information. We have right now we are giving the uh, uh, some concession discounts. Basically, the scholarship basically is ongoing from academically, and we also have a EduOne's partnership. So you can pay the hour fees in 3 months, 6 months, 9 months, or 12 months without paying any further interest. This is an interest-free loan. Will help you to get. These are some of the reviews, and yeah. So I'm basically, I can talk to you one on one now. So if you have any questions or any doubt, please you can unmute and please ask one on one.
Sir, I guess there is a question on the chat section from Sudarshan Gupta.
Hi sir, this one part to clear. Then AMC has to be written. Yes, AMC written. You need to pass. You only no need to go for Epic verification. Except Epic, you have to go for again for this AMC exams.
Hello. Yes, sir.
Yes, Dr. Nishit.
Sir, I just want to inquire regarding one thing that recently one of the public have passed AMC Part 1, one of my seniors, and they have moved basically since 6 months. Some of my seniors have also cleared AMC Part 1, but they are saying that the job opportunities are getting less. And AMC Part 2 is a must to give from India, or we can still have a chance to.
No. Even
Uh,
part two, you can write from India itself. After the COVID,
okay,
it is online. So this is
okay,
now
okay,
the good time. Before
okay,
COVID, you need to come to Australia in Melbourne. You need to write this AMC part two. Okay, but
okay,
now
okay,
if you are working in India, so my suggestion is to go for part two as well from India itself and pass.
okay.
Then you can come. Yes, and
But sir,
the opportunity is basically not less. The
okay.
problem, many doctors, they are coming in Sydney and they are looking at a job in Sydney. They only want to work in Sydney.
I got it,
So
sir. Got it.
if you are
Okay.
free, if you are saying
Yes,
that
yes,
"Sir, I am free anywhere in Australia,"
yes, 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 sir. Yes.
then you will get the more opportunities.
Okay.
If you
So
are in,
for footing, you must be ready to go at distant and regional place also. Yes,
yes,
yes.
yes.
Because
Actually,
yes.
even our two faculty, they are going to teach you this in AMC.
Okay, sir.
So one faculty, she is working.
Okay.
She also got some time because her husband is working here in Sydney.
Okay, sir.
She
Okay, sir.
do not want to move to regional area.
Okay.
In
Okay.
that case, it
Okay.
might take you a little bit longer time to because you have very specific time.
Got it.
You only want to work in that area, right?
Got it.
But if you are free, you will definitely will got the job.
Fine, sir.
And
Fine.
I can show you one more thing. And might be I
Yes.
also did discover
Yes, sir.
work for
Excuse me, you had just now told about MLE.
yes. Someone
So
asked a question.
if part 1 and 2 are cleared, then we need to repeat AMC.
Again, yes, 100%. But why US only for US, not for Australia. So if you
But
are
sir, if PLAB is cleared, then they say that we need not to give AMC.
no. Again, you need
Okay.
if you are
Okay.
registered, you are fully registered in UK.
Okay.
Then you need to write.
Huh.
But many doctors think that we can just write PLAB from India and we can skip this AMC. So this is not the.
Okay.
You have
Okay.
to go there. You have to pass PLAB 1 and 2 and complete there. As a GMO, you also work 1 year training and you got your full registration.
Okay.
And then you can come to Australia. Then no need to write this AMC part one, part two. But
Okay.
if you are thinking that I can write part one from India,
Okay.
then no.
Okay. MLE does not hold good in Australia.
No, no, USMLE are also basically the epic verification, the part one.
Okay.
No need. If you already passed it, USMLE, but
If passed USMLE, then
yes, if you pass USMLE part one and part two, still you need to go for this AMC.
okay, both parts.
Yes.
Okay,
So
sir.
this is basically a government of Australia website called Workforce Australia. So
Okay.
anyone in Australia, any Australian company, any looking a job, looking a basically a candidate, they want to basically give a visa, a sponsorship. So they have to mandatory upload advertisement is here. So now if we go here like resident doctor, I never search basically. I'm just going to see, uh, yes,
Sir, those who have completed post graduation from India, so they also will have to write the AMC.
yes.
Okay, so I saw something called a specialist pathway or something like that in the site. So I just wanted a clarification regarding that.
Yes, I mean you can see here a lot of jobs are available. Those are
Huh.
past AFC part one. They can apply from Workforce Australia website. Okay. So
Okay,
basically, there are two things. As you know, in India, like if someone want to apply for AIMS, for example, so eligibility is very low. Like everyone has 60% marks. And like need they can apply, but very hard to get admission in AIMS. Right? Same is here. Those are completed MD or MS from home countries, so they are eligible to apply for a specialist pathway. But in practically, they are not able to get. Yes, they can get if they have experience, at least 10 years working experience, and they have very extraordinary CV. For example, you did some research or you did any extra things. In that
Mm-hmm.
you can get. But if you just complete your MD or MS, Sharma have only
okay,
3 years working experience in India. So if you have 8 or 10 year experience, then you can apply for specialist pathway. Nothing to harm, just give it a try.
Yeah.
Otherwise, you have to go with this pathway only.
So if I'm applying through that pathway, will you be able to help me out?
No, no, no. There is no
No.
need to anything that you just need to apply directly for the school. There is no need to be any coaching or anything need for that.
Okay. Okay. Thanks.
hello.
Hello, sir. Hello,
Yes,
sir.
sir.
Actually, I have a doubt.
Yes,
So
yes,
the
yes,
thing
one
is,
by one. Yes, yes, go
yeah,
please.
I have a doubt. Actually, if I complete AMC 1 and AMC 2, and I have 6 years experience in critical care, but I didn't do any specialization after MBBS. I have 6 years experience and I completed AMC 1 and 2 and English exam. Now, can I get into directly residency without doing an internship in Australia?
No, internship is mandatory, in that. But yeah, they might reduce your internship hours. So
Okay, okay,
internship is for like 1 year. So
okay.
in that case, they might say you can go for 6 months. You need to understand the Australian system to work here.
Mhm.
Without internship, you cannot work here. So, but AMC basically is like individualized. If someone did maybe the PG or experience, so they might reduce the number of hours. But
Mhm.
uh, the doing internship is mandatory. It might be 6 months or 1 year.
Okay, thank you.
Sir, actually, what are the chances after of getting a job after clearing MC1?
There's a good chance if you have some experience in India.
I mean, actually, by the time I clear, I think I will have about, with including internship, about 18 months.
Yeah, that's good. Good. Basically, here in internship, if you are doing in India, they consider as a work basically. Okay, so आप 18 months you can show there is a good chance I can say. That's why I'm saying if you are
Okay.
final year students, so please do not show any
Yes.
gap.
No, no. I,
Continuously
I,
start
I
work.
clear. Actually, okay, okay, okay.
Sir, I have a
Sir,
query.
any
Sir, there are
Thank
two
you, sir. Thank you.
questions. Akram, sir, there are two questions from Nahida, Nipa, and Nishit on the chat. If you can take their questions, they have asked a long time
Okay,
back.
guys, I am here for 2 hours. No need to worry. Because you can ask me as
okay,
many
sir. Okay,
you
okay, sir. Okay, sir.
Nice, Dr. Nipa. No. To get the visa, you must pass the exam. Without passing exam, you cannot apply any visa for Australia. Okay, even you pass AMC Part One, uh, you only can apply a work visa after you got a job. You are eligible to apply that PR visa after you pass Part Two, AMC Part Two. So this is not just for you. Any healthcare practitioner, whether it is physiotherapist, nurse, pharmacist, or a dentist, everyone has to pass two exams. One is the MCQ exam, then is the practical exam. And without practical, you are not eligible to apply any PR visa. So you can apply only work visa once you pass AMC Part One. Without passing the exam, there is no visa. And next is the issue of yes, definitely. You are, since Dr. Nishit, you already did master degree, I think, in anesthesiology, right?
Yes, yes, sir. Yes, sir. Yes, sir.
Yes. So for you, is I can say very, very good chance for you. You will definitely, they'll give you the first consultation for you. Since you are already, those are already completed PG or they are doing
Yes.
PG. Maybe you are in year 2 or year 3 in India. So I can say for you, is very, very good chance. You will get very straight away, the preference for you to go for this fellowship in PG in Australia once you complete this AMC2. Yeah, Dr. Manisha, you're asking some question?
Yes. Sir, I want to just know one thing. I am MS Gynae with 17 years experience, and my husband is a pediatrician. So both of us want to migrate. So, like, what are the chances if we
Yes,
together
so
get a
you
job?
can, yes, you can directly go for, if you have 17 experience with PG, so directly you can apply for this specialist pathway and no
Okay.
need to go for this exam. Okay. And if you are getting a negative outcome for that, then you can come to us. We can help you to pass
Okay,
this
sir.
exam. If
Okay.
your husband also is a PG, then you both
Yeah.
can try basically.
Yeah, he's a pediatrician. He's a MD guy. So, can we apply like as a like together? We can apply in the same
Yes,
university.
both. Forget about your husband. You apply individually, or your husband has to apply individually for
Okay, sir.
as a pediatrician, and you have to apply as a gynae. Okay.
Okay, sir.
Anyone will got. You just come here because anyway, you got your husband will be on dependent. Or if your husband got and you are not getting, then you will be dependent on your husband. So it's very
Okay,
easy.
sir.
Sir, is there an age limit, like to
Yes,
apply?
age basically, for writing exam, there is no age limitation. But
Okay.
get here with a permanent visa citizenship in Australia, there's an age. So your age must be below 45 years of age. 45.
Okay.
Yes.
Sir, there is a question on the chat box from Dr. Dheeraj. I am Dr. Hayaz.
We are joining for MPH question asked. Is there any better question? I mean, you have no other option. After MPH, you are not going to get any job in Australia. Okay. So you just need to pass AMC Part 1 and we can help you. So while you are in Australia, you can start looking a job straight away. And do as soon as possible. Otherwise, you will be in trap basically. Many doctors, they are coming on MPH in Australia, Master Public Health or Health. Basically, there is a two type of PG. We can talk like non-clinical or clinical. This is same like in India. So if you want to do any non-clinical PG, maybe it is like anatomy, physiology, biochemistry, microbiology, or public health, health policy. There's so many things, hospital management. So for these, no need to write a CMC directly. You can get the admission. But getting a job is very, very difficult for you in that case. Okay. So if you are coming any of this non-clinical course, so advise as soon as possible pass AMC Part 1 and start working in Australia. Even you can get a observership here and then you can enter in the job. So observership, many nowadays, not a single hospital in Australia without Indian running. So Indians must be there, and please also be a little bit active on LinkedIn or social media. Also make some friends from. We have basically a network also with alumni, so we may also help you if you're joining academically. So they will also help you to get it's not just in the job, to do the things you need. They will guide you your registration and visa, jobs, and you also need some local reference also when you are applying jobs also. Okay. Yes, next please.
Hello, sir. I am from hello.
Yes, please.
Sir, I am from Nepal and I have like recently completed my MBBS. And from January, I'll be like joining the internship. So what I want to ask is like, when is the right time for preparing for this, all this AMC and
The right
everything?
time for you, I can say you could just start preparing now, but you only can apply once you get registered as a RMP. Okay. So we will now onwards you can start preparing. This next week going to start new batch, so you can start preparing, and once you are ready, you can go for the exam.
Sir, for applying, I need to complete my internship and get my license from the Nepal. Then only I can apply for the further procedure.
So internship is like 1 year you left.
Yes, sir.
Okay, so it's long journey for you, but it's still if you want you can, because for AMC you need maximum 6 months, minimum 3 months your effort to pass this exam. If you can give around 3 to 4 hours, at least 3 to 5 hours per day for 90 days, definitely you can clear this exam year faster. And this is very easier exam as compared to our NEET PG in India, or maybe an MC exam in Nepal.
Thank you, sir.
Thank you. Yes, next please.
Sir, again, there is a question from Dr. Nishit. Yeah. On the chat box.
Yes, sir. Just ask the question.
Yes, you can apply as I mentioned, there is no harm. So you just
Yes,
go to website, basically in Australia, there is
yes,
no
sir.
such exam like in India we have like NEET PG, and then any university or any hospital you want to apply, you have to show that score. So here in Australia, so there is a school, there is separate schools is here. For example, option gynae separately, pediatrics are separately, same for critical care or emergency medicine. So you have to apply there, okay, directly. So you just apply there and just wait for this. If you are not getting, you are getting any negative outcome, then you can go for this pathway. Otherwise, you can try for that expected path. If you are getting, and if you are coming on short-term training, is very difficult to. If you want to go back to India,
Mm.
in that case,
Yes,
you can come on that route. But if you are planning to settle down in Australia, so highly
yes,
recommended
yes.
go for the specialist pathway or go for the student pathway. Or go for a
Perfect.
registration.
Perfect.
Okay.
Sir, after completing AMC 1 and 2 and internship in Australia, if I want to get a surgical branch, what is the criteria? Do they consider any marks of AMC 1 and AMC 2,
No,
or
no, no,
just like
no,
that
no.
we can
After
apply?
AMC, you are equivalent to Australian. So now they will see your competency, your CV basically. Uh, Nothing like this. And here in general, the each hospital they might have their own interview. Mostly they will conduct interview or some short that are test, and based on that they will give the preference. And here one more thing, there is no nothing, there is no partiality like you are international candidate or you are from India or something like something like this.
So they don't take any consideration of marks, only based on
No,
interview, and they
interview,
will take it.
interview or
Surgical
your,
branch.
yes, on CV, your performance. Okay,
Okay, thanks.
based on that,
Thanks.
at university, I'm here basically working earlier at Westmead Hospital. This is one of the top hospital in Australia in
What is the name
NC.
of the hospital, sir?
Westmead,
Okay, okay,
Westmead
okay.
Children's Hospital or Westmead Hospital. WESTMEAD. This is the number one hospital in Australia, you can see. So in this hospital, so when I went my first day in this hospital for a job, so there is one guy, so his name, I thought he's like, he's like a white guy, but he was an Indian. He's from Kerala. So and then I worked there sometime. Then I see I observed all the department. I can say at least 20 to 25% staff are Indian basically. So if you are going in any hospital anyway, anywhere, you will find many people are Desi guys. You will find many like Indian. Some might be like Pakistani or Sri Lankan or Bangladeshi, Nepalese, very low. But Indians is lot is here.
Thank you. Thank you very much.
Thank you, guys.
Sir,
Any
are you gonna give coaching for AMC 2? And how
yes,
would be the
definitely.
charges? How would be the charges? And
Actually, you know,
how much
once
is the
some
course of time?
pass, yes, once pass some students from part one, then we will start part two.
Thank you.
Dr. Nishit, are you saying something? Your voice is not able to hear. Okay, guys.
Sir, no, sir. No,
Okay.
I just clear the doubts.
Okay. Thank you.
Thank you, sir.
Final call to everyone. Anybody who has a question, please ask. People who haven't asked their questions can also unmute and ask their
Yes,
doubts.
Dr. Dheeraj, please ask. You have time. Yes.
Hello.
Yes, Nazim.
Hello.
Yes.
Hello, sir. I'm Dr. Chuiti from Bangladesh, and I have completed my internship and MBBS from Bangladesh, and I have 1 year of experience. And now I'm planning to give AMC Part 1. I just want to know about your course and duration of the classes, and as well as the fees about the course, because I'm planning to give this exam around February or March. I have
So,
already started to take preparation a little bit, but actually it seems a haphazard for me. That's why
we provide.
when your course will start and want to know about the course routine also.
So basically,
Thank
our faculties are, as I mentioned, they are working. They are in Sydney. Okay.
Yeah.
So we take classes evening time with these doctors. Okay.
Okay.
Like Sydney time, 8 to 10 p.m. So in Indian time, around maybe around 2:30, around something, that timing. And weekend, they might take in the morning time, Saturday or Sunday. So weekly, 8 to 10 hours lectures we need to cover because we need to finish this course within four months. Okay. So we will
Okay.
cover A to Z theories. Okay. So you need no need to buy any other book or something. We will provide you the study material and guidance and plus lot of mock tests based on last 10 years question papers and all those things. So this is like a complete uh, 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 the preparation we will provide you. You no need to buy here and there to see anything else.
Okay, sir. Please tell me about the fees for your
Fee, yes,
course.
our team will get back to you, or maybe this link is given by on your WhatsApp, right? So
Yeah.
you just say to hi to that person. He will connect to you. He will give you the information regarding the fees.
Okay, sir. Thank you.
Thank you.
Sir, if I relocate to after MC1, and if I get a job in some part of Australia, and if I want to take my dependents like my mother and father to Australia, how fast it can be, and is it
Basically,
possible?
you basically after 18, you are independent in as per the Australia. Okay? So your parents are not dependent on you. Okay, you can file the visa with your dependent. Dependent means your wife or kids if you have. And so for parents, once you migrate to Australia, you got your PR visa, then you can apply separately visa for your parents. Okay, so they will not come with you. Okay, because they are not dependent. So once you migrate to Australia, then you can call to your parents. Like me, I also call to my parents. They have like 4 years visa, so they can come at any time to see me. So like this.
Oh, okay. Okay. Thank you, sir.
Thank you. So basically, anyone is here, the parents or maybe like your Sas, Sasurji, they are not dependent on you. So once you migrate to Australia, you can call them after that. But in your application, your husband or your wife or your kids, they are dependent on you. You can file or you can migrate with them to Australia, but not the parents.
Okay. Thank you.
Thank you. Please, this is the last chance for you to interact. Please unmute yourself or ask any doubt if you have any. Otherwise, we can finish here. I think we have done.
I think so. We're done. I think Nishit, your hand is still raised. Any final question, Dr. Nishit?
No,
I
no,
can
sir.
see your
No,
hand.
sir. No, sir.
Okay.
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 Thank you so much.
I think
No,
then
no,
it's
sir.
done.
No, sir. No, sir.
Okay. Thank you so much. Bye.
Hello, sir. One last question, sir, if you don't mind.
Yes. Yes.
Can you
Please
tell me
give us
about how to
your
upgrade?
information, your phone number, email in the chat box, so we
Yeah.
can connect you when we got time to time some information or some updates. So we might give you. So please give us your contact detail in the chat box. Yes. Yes. Please ask your last out.
Uh, uh, just forgot. Uh, yeah, sir. How many hours of session it will take for part 2?
Session
For
basically
example,
the part is session 2 hours. So
2 hours for 4
we
months.
yeah. It's not 4 months. It's 3 months we will finish. Then last month is the revision.
Okay, okay.
Yeah.
Fine, fine.
So altogether 4 months.
Okay, okay. Thank you.
So the session is going to be 2 hours. And in between there's a break for 5 to 10 minutes, in between like 1 hour. So yeah. So this is like
That is also online, not offline, because
no,
we
no,
have to
no.
do clinical examination, right?
Yes, this is online basically. Our faculty is in Australia, Sydney, right? So we cannot
Okay.
take there is no offline coaching, it's online coaching only. So we have our mobile application. So you can access from mobile, or you have maybe have a laptop or desktop. We have LMS, learning management system. And we have also community portal. So you can interact with directly. You can ask any doubt, or maybe you can interact with your own peers, one of your friends also. You can ask any doubt.
And if I get after AMC1, if I get a job there, and it will be more paid in cities and less paid in rurals, right? Rural
Yes,
areas.
rural area more chance to get job and high salary also.
High salary. Okay.
High salary, yes, because the local do not want to work in regional area. So the IMGs they hire international medical graduates. So they pay high salaries.
Okay. Okay. Okay.
Okay, thank you so much, guys.
Thank you.
Thank you. Thank you. Bye.
Bye. Thank you.
For everyone, this was also recorded on YouTube. Okay, so in case you want to revisit, you can go to our YouTube channel, and listen to it again if you want to, for any clarity.
Yes, there is a separate YouTube channel we have for AMC. This is Academically.MedPrep. So you can go there, you will find a lot of videos, interviews there. So, okay.
Yeah. Thank you, sir. Thank you.
Thank you. Thank you. Thank you. Bye.
Sir, one last question, if you don't mind. Sorry to
Yes,
apologize.
yes.
Repeat. Yeah. So to build up CV, can you give me any suggestions? Means if you have to start preparing to CV regarding CV from now itself, or only after completion of AMC1? Do you give me any idea?
After you finish this, then we will give you, our faculty will give you, that everyone will give you some sample CVs as well. We will guide you.
Yeah. Thank you. Thank you.
Sir, can I ask the last one?
Yeah.
Sir, like, what is the pathway to residency after clearing AMC1 and AMC2 in Australia?
So in Australia, once you pass AMC Part 1 and you have to register as a an RMO in Australia, right? And then you have to apply for residency, right? Even here, this GP also a specialist pathway only. So you must be a specialist to practice in Australia. Okay. So for that you have to apply. For example, you want to go for surgery, you want to go in internal medicine, XYZ, whatever your branch, you have to apply after you pass AMC Part 2 and you got this registration.
Can you just tell me what is the difference between RMO and GP practitioner?
No. RMO only you can work in, under supervision. You are not an independent prescriber still. GP is an independent prescriber.
AMC1 if you clear, I can get RMO, and AMC2 also if I clear,
JMO
GP.
or RMO. JMO means junior medical officer. Those are very young freshers, do not have any clinical experience. They might offer you as a JMO, junior medical officer. But if you have some experience, for example, 6 months, or maybe you did internship, or someone did like PG. In that case, they may give you that RMO, resident medical officer. But not much difference. You have to work with basically supervision. This is like same like in India when you are doing your internship. So in India, in legally, you are not you cannot prescribe any medicine in India. So there might be some lecturer or might be some any PG1 and PG2, 3. They are guiding you, right? When you are doing internship in India. So same like in Australia as a JMO, if you cannot prescribe, but you have to work under supervision. Or same for RMO. So RMO has there's a 4 categories. 1, 2, 3, 4. Based on your experience, they will give you which one you are. But most likely, if someone is from graduate from India or completed internship, then most likely you will go for that 2. It means that you no need much supervision.
Supervision.
Yeah.
See, to get a GP practitioner name, I have to complete AMC 1 and 2 and interview and 1 year of 10 months of internship there, right? That is correct?
No. For GP, specialist in basically foreign countries, any country, whether it is US or Europe, Canada, Australia, or UK. Here, there is a 3-year pathway for GP. It's called basically, it's called family medicine.
Okay, internal medicine, right?
Family medicine, kind of internal medicine. This is like the same, like cardiac things and like diabetes, all those things. You are managing.
It's a post-graduation course, right? GP means?
Yes, this is a post-graduation. After this AMC2, then you have to apply again. So easiest way to get, this is a GP pathway. But if you are looking to go for like internal medicine, like pediatrics, so it may take difficult, or it may take required more years. So here the residency 3 to 6 years is based on the specialty, which one you want. For example, surgery.
Okay.
Surgery might need additional because they give here the super specialization in surgery. So it might take 4 to 6 years.
Oh, okay.
But you will get getting paid for that. It is not free. You are getting 120,000 Australian dollar, maybe like 5 to 6 lakhs per month, while you are doing this PG. So it is not free basically.
Fine. Thank you.
Thank you so much. Okay, guys, thank you so much. If you have any questions, tell to our team.
One last information. I think you got this link through one of our counselors only, right? So if you have further questions, just revert to the counselor with a hi.